All right, hi, it's Dr. Buford. We're just getting started on the left shoulder. We're looking in from the back to the front. Everything that you see is magnified 30 or 40 times on the screen. And just to catch you up on what we've already done, once you were under anesthesia, we examined your shoulder, and your shoulder would completely dislocate out the front, actually without much force at all. And when it reduced, there was a pretty palpable click as it reduced, and I think you were feeling that a lot. And so now when we get our look inside, we've got two cannulas, or about to have two cannulas coming in the front. We've got this blue one there, and we've got this rod here. As we look down, we can see the prior surgery. Looks like it healed. It just looks like things are still really loose. Okay, so there's some suture tape there. See that? And then in the back, it looks like there's two suture tapes that were put in. And again, with what we found on the exam, I think we can make this better. So we're going to go off on the video. I'm going to move the scope up to where that stick is coming through, that switching stick. Okay, so we're looking from the front to the back. You can see where they put, it looks like 3 separate anchors in the back and 1 in the front. And like I said, you're coming out the front now. This is the bare area in the back of the humeral head, and we're going to do what's called a Remplissage procedure. And so the next step for us would actually be to put in an anchor down here and an anchor way up here to help reduce the humeral head. Okay, so we're roughening up the bone here, preparing a new surface so that it will hopefully heal. All right, and now we'll get ready to place our anchor. Okay, here's the first triple loaded anchor. You can see when I pull on these sutures, you can see how it's going to reduce the humeral head there for us. So we'll get to work passing these sutures and show you some more in a little bit. No, spinal needles. Crochet hook, and probably a pincher tool. You can get rid of that gold thing. We won't need that. You can get rid of that. Okay. Hold the camera. Can you reach with your right hand? Right hand? Uh-huh. Got it? I got it. Okay, spinal. Let's pass a relay. Oh, no, let's not do that. Careful with your mask, but reach around with your left hand and hold this. Yeah, let me scalpel. Why is this? Where's the pump? I got it. Okay. Relay. Okay, hold it again. Huh. Okay, with the right hand you can hold this. Pull the blue and white one. Find the blue and white one and just pull one of them so we completely pull it out. Is that it? Pull it out completely. Yeah. Just give it to her. All right. Hold the camera left hand. Pull the needle. Just pull straight out. Just pull straight out and give it to her. Great. Okay, right hand on this. Uh-huh. So what you need to be thinking of is like, where am I going to be working? That's why I'm saying left hand, right hand. Any questions?
You can do 1 acre or 2?
I'm gonna do 2.
Those come in. I was like, someone needs to come up with a device that make passing these stitches easier.
Yeah, I mean, some people will go into the subacromial space first, but I'm way posterior though, so yeah, and I just think this is,
Stryker's got a product that might be the best, the NanoPass,
yeah,
but it's still, you open a bigger hole, you want to keep that inside hole.
yeah. And that's just it. You can see the capsule's already super thin. Hold the camera, right, left hand. Yeah. Oh my God. Just grab it, Bonnie. Oh my gosh. I mean, seriously. How hard can it be? Right hand. Ah, crap. I forgot to do something I wanted to do. Good. I'm glad that happened. Give me the spinal needle again. Okay, scalpel. Hold the camera. Left hand. Okay, relay. Left hand. Okay, left hand again. Pull the needle out. Right hand.
You're the only one in Dallas going to the meeting in, what, 2 weeks?
Anna?
We've got another surgeon in Dallas going.
To Anna?
Yeah.
Really?
They sent us the like registration list, and you're the only person from Dallas. So I guess,
I wonder what's happening to Anna. That's not a good sign.
which is, at least in my time, it's been very few Dallas docs that go to a lot of meetings. I don't know why.
That's why not all of them are awesome.
North Dallas has more than most of the DFW area.
Yeah,
We got a lot of you guys usually.
yeah. Okay. What do you got? Give me a grasper. Give me this. Sorry.
Do you have any recommendations?
I mean, I'm going early because we got board meetings and just a bunch of stuff going on. So I don't even know that literally that I have any time. So you going for the whole time? Are you going? Yeah. Yeah, and I'm going out. We got to go out a couple days early.
They've shut down reps going so much in the past.
Really?
I don't know why, but no company likes reps going.
They just get the local people to man the booth or what?
Local people will go. So if we got reps in the area, they'll have them go. I think they're just cutting down on expenses.
Yeah. Left hand. I mean, it's growing. You know, the numbers we see in terms of membership, it's growing, and the meeting seems to be left hand. Meeting seems to be going strong.
Yeah, I mean, the attendance list we got is huge.
Yeah.
It's impressive.
I mean,
Dallas.
we got a bunch of things that I'm helping with also, like ultrasound stuff and biologic stuff also. They made the mistake of putting me on the finance committee also. So as soon as I get passwords, I'm done.
Yeah. You were
I'm
going to be
be like, yeah, they can track me down if they can. Needle out. Be on a boat in the Mediterranean. Okay, here you go. Right hand. What's that? Yeah, Anna's gonna pay for the boat. Yeah.
everybody else is paying.
Yeah.
I'll do another show.
I think I've earned it. I feel like I've earned it. I've been going to Anna for a long time. Okay, recording. Okay, recording. So here you can see the two sutures passed. And that looks good. We've got a blue and white striped one and a solid blue one. And now we're going to place a second anchor right about here where you see that blue cannula. Okay, so we've got two anchors in and a total of 4 sutures tied in a mattress fashion to give us kind of a pants over vest construct, and I'm happy with that. Now we're going to look down the front of the shoulder and see if we want to do anything to tighten up that anterior band of the inferior glenohumeral ligament right there. And I think we'll at least put in 1 anchor, so we'll go ahead and get that ready to go also. I just wanted to show you I think we can tighten things up a bit. This suture that's in from before is not tight anymore. Hard to know when or how that happened, but it's certainly not tight now, so I'm going to cut it out. And we're going to place in some new ones and tighten them down. So right now we're just using the scissors. We've already placed the new anchor. That's this black and white suture. But now we're just going to use our scissors to cut the old one. Okay, so we've really tightened down that anterior band of the inferior glenohumeral ligament right now. You can see that black and white suture is very tight. We're going to place 1 more anchor to make sure we have this ligament straight, the blue handle, plicated. So we'll show you some more in a little bit. Okay, so here we've placed 2 anchors and we've tied 2 out of 3 sutures. The second anchor, the one we're working on, is double loaded. So that's why you can see we've tied the blue one, but we haven't passed or tied this black and white striped one. So we're debating whether or not we're going to use it. I can't think of a reason not to use it. So we're probably going to use this to further plicate the capsule right back here. We're going to do kind of a pants over vest and bring this anterior joint capsule down to further reinforce the anterior part of your shoulder. So this instrument is just a rasp. It roughens up the soft tissues, helps create a healing response. We're trying to make this like two pieces of Velcro that just stick together. Okay? But it's looking good. Happy with the way things are coming together right now. Okay, so you can see we've tied the second suture now. So we've got 2 anchors in the front, 3 sutures, and now we're going to go to the back and tie the remplissage sutures back here. So this will be the end of the video, unless we have something else that we want to show you. But for the most part, this is the end of the video. The only thing left to do is to tie these sutures, which is going to further pull back and support the humeral head and keep it reduced. So good luck to you now. I really hope this does the trick for you, okay? Bye-bye. No. Okay, so we're all done. We've tied the remplissage sutures. And you can see we've still got the water on, so we'll turn off the water and you'll see how things collapse down. That should heal nicely right there. And I'm happy with the way that looks. So good luck to you now. We're going to get you back to the recovery room shortly.